Well, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, my special guest this week is U.S. Senator, he's our senior U.S. Senator from Pennsylvania, Bob Casey. Let's get to it.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, a couple of weeks ago, we had Senator Pat Toomey on the program. We invite our both U.S. senators on. We try to get them on a couple of times a year. Joining me today is Senior U.S. Senator Bob Casey, former Auditor General, former State Treasurer. Senator, it's great to have you, as always.
Terry, great to be back. Thanks.
Yeah, well, as I said, we want to get both of you on the program as much as we can. You're busy in Washington. All right, I want to talk about what you've been working on that really deals with our state. But before I do that, we've had this horrible situation, the immolation of this Jordanian pilot. They're asking for aid. We've got this situation in Ukraine. It seems like all of a sudden, ISIS should, now everybody agrees, even the most conservative, from conservative to liberal, no American troops. Would you agree with that?
No combat troops,
That's
for
right.
sure.
Yeah, okay, yeah. Great point. What should we be doing? Should we be helping with more arms and more give us, you were on the Senate Foreign Relations Committee.
Yeah, well, first of all, when it comes to what happened in Jordan, first of all, as a nation and certainly in the position that I hold, we've expressed our condolences. It was among the most horrific things you can imagine, even in this era when we never cease to be shocked at what happens around the world. But that's number one. Number two is Jordan was part of and remains part of the 16-nation coalition against ISIS. I think they will be a more determined part of that coalition because they're going to take it to ISIS and are already starting
the bombing,
to go at them. And that can only strengthen what is, I think, a good effort by the President and Secretary Kerry to keep that coalition together. Thirdly, I think it's important for people to know that the people of Jordan have already contributed mightily to efforts to help stability in the region. No country in the region has done more to take in refugees from Syria, prior to that in Iraq. The number of people, refugees in Jordan, is the equivalent to 30 or 40 or 50 million refugees in America. It's such a small country.
And they're relatively poor. They're not one of the wealthier, they don't have the oil. Go ahead.
Yeah. It's just a great ally for us, and we just feel so terrible about what happened. But I think this coalition has to stay together because this fight against ISIS is going to take years, not months, several years in my judgment. And it's one of the reasons why we have to have a debate about war powers and the authorization for force. The Congress has to do that. Not only because of what's happening with ISIS, but generally to debate that issue. I think in terms of Ukraine, I do think there's an emerging consensus, or already a consensus, that we should provide more lethal support in that instance. Parallel to that and happening at the same time as the debate about arming, Secretary Kerry is working very hard right now to have a peace process move forward. We've had something on the order of 5,000 deaths. And it's better if there's a peaceful resolution. But
one of the scary things, as an observer, I mean, you know more about this than I do, is how borders, Russia. I mean, they obviously can intervene a lot more quickly with a lot more. I mean, there are Russian troops there, as they're disguised, and Russians are supplying them with tanks. Should we be at least supplying them with arms? I mean, if you were, is that a minimal thing? I mean, there's other things we can do, but that seems to be the call right now.
I think there's going to be an effort, or at least in the Congress, I think broad support for arming and for helping. I do think, though, that what folks like me were saying months ago has proven to be true on the economics of where the Russian Federation is right now. Mr. Putin was very aggressive and continues to be, but he's finding it very difficult at home to manage a tough economy, and that will have an impact on where we go from here. But I think it does make sense to provide arms, and I think we're going to have a consensus.
All right, I'm chatting with Senior Senator Bob Casey from Pennsylvania, obviously. I want to talk about ABLE. That's a bill that the Associated Press has called the most significant law for those with disabilities since the ADA. Senator Casey is involved in, is it an amendment to that?
The ABLE Act is a...
No, I know that, but
right.
are you proposing an amendment to it or a modification of it?
No, it's really it's a new bill.
Oh, okay.
A new bill, a new legislation that will very simply do in the context of helping folks with disabilities save in a tax-free way.
All right,
as we do for higher ed.
All right, we're going to get into the details of that. I think this is an important subject, and the senator will help us out.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. My special guest is Senator Bob Casey. He's straightening me out. The host is ignorant about what he was talking about on the ABLE bill. Get into the detail. It's bipartisan. A rare moment of bipartisanship broke out. Go ahead.
In a tough Congress the last 2 years, I don't think there was any other bill that had more bipartisan support. Here's the frame that we start with, which is we believe, I think Democrats and Republicans believe, that people with disabilities have a lot of ability. In other words, a kid who has Down syndrome and goes through their years in school and then gets into the job market, many kids with Down syndrome can hold down a job. They can have an apartment. They can pay for transportation. But they don't have a way to save for those transportation or job-related or health care expenses related to their disability. This allows them to do that, to save for a disability just like you save for higher education. It was a great idea, but we had to work very hard to get it passed.
And
Both
it's a
houses,
tax advantage program like the 529
Exactly.
style savings accounts, is that right?
Exactly. It's the
Passed
same
now,
same
bipartisan, from 400 plus votes in the House, 77 in the Senate.
And the Senate would have been higher because in the House they voted on it separately. We had to, it got fused with other tax provisions, but some people didn't like. So it would have probably been closer to 90 or so in the Senate. But it's a great advance forward for folks with disabilities, and a lot of families worry, like I can't even imagine, that when that 7-year-old is 25 or 30 and they're in the workforce or they're on their own, that they won't have an account that they can save into in a tax advantage way.
And who knows what also happens to the parents and the grandparents and who, that's, All right, there's something else that I noticed that you got involved with, and we've talked on this program a lot about medicinal marijuana and legalizing marijuana. It's a huge debate, about the pros and the cons of things that hurt people. And I'm not relating those, I'm just saying we've got these subjects that come up in which we're dealing with subject matter that has some potential harm. You talked about, and there's also potential good with medicinal marijuana. You've asked the FDA to ban something that I never heard of until it doesn't mean much, till you brought it up, called powdered caffeine. What's that about?
Well, it's led to 2 deaths, one in Georgia, one in Ohio, so it raised the level of awareness and urgency. And what I've asked the FDA to do, and they've taken some steps to focus on this, but I've asked them to at least consider whether it's a ban or some other action to be more aggressive in light of the threat. This is, just a teaspoon of this powdered caffeine can have the potency of 25 cups of coffee. Just imagine if you had 25 cups of coffee that quickly.
To get sort of this high to maybe to jumpstart or for whatever reason.
Unfortunately, some of these folks that have ingested this, they're not taking just a teaspoon, they're taking a lot more than that. So it can be very dangerous. So we're asking the FDA to consider either the equivalent or ban or something more aggressive.
$1.75 per ounce in this Pittsburgh Tribune. That's all it costs, so it's not like you have to go out and spend $1 zillion to get it, right?
Exactly.
Yeah. There's something else fascinating along this. I don't know what you think about this, but I'm going to ask you. We got this measles outbreak, and I sort of look. We don't have a lot of occurrences in our state yet, but should there be a compulsory requirement for a measles vaccination? Do you think? Yeah. What do you think about that? We know we have exceptions here for religion and philosophic in our state. I looked at that.
Look, I think it's an important debate to have, because we have to follow the science. We have to make sure that public health is protected. So someone might say, well, I don't want to do that. Well, you're part of a community, and we're seeing the terrible adverse effects when enough children are not vaccinated. Something we thought we had ended or controlled, eradicated, is now a threat.
And the science of it is you get 90% of the people who aren't going to get it, then it goes away. And I'm thinking, well, my gosh, what about smallpox? We eradicated that. How about if people didn't get the polio vaccine? Yeah. I normally don't express views of my own. I don't get it why, if you're out in public, you've got it. It's not like it's just about you. It's the most communicable disease that I know of. That the doctors and medical experts have said there isn't anything more communicable. Why can't we, And I don't want a lot of intrusive laws, but that would seem one that, you don't deal with that at the federal government level so much. That would be a state.
Mostly state by state, but it's an issue that people have a debate about. But the science tells us we can eradicate it. We've already achieved that. Right. We should seek to do it again. All
right, we're going to run to a break, pay some bills. When we come back, I want to talk to the senator about a bill targeting Medicare payments for rural pharmacies. We have, I think now we're the fourth largest rural population in the country. Lots of senior citizens who live in rural parts of Pennsylvania. We're going to talk to the senator about his proposal dealing with Medicare payments for rural pharmacies.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Welcome back with U.S. Senator Bob Casey. We're chatting about now a whole bunch of subjects that the senator has been involved with, topics, issues dealing with our state, fill you in on what's going on in Washington. All right, huge rural population, Medicare payments for rural pharmacies. I've never heard of that. We do a lot of health care. It's something that I think our viewers would be interested in, given the size of our rural population.
Yeah, I think sometimes people forget that rural areas not only were devastated by the Great Recession, but they have substantial health care challenges that I think sometimes are overlooked. This particular issue is really focused on the fact that in rural areas, sometimes on a more routine basis, folks living in rural areas, especially over the age of 65, will have more contact with their pharmacist than a doctor necessarily, because the doctors are far away. Pharmacists can't do everything a doctor can do, obviously, but they can do things like health screenings, can help them with kind of basic health care needs. And that's happening on a regular basis. The problem is those pharmacists, for those very specific, the very specific help they provide to older citizens in rural areas, they're not reimbursed for it. So Chuck Grassley and I and Sherrod Brown from Ohio, Mark Kirk from Illinois, two
Bipartisan?
Democrats. Yeah, 2 Democrats, 2 Republicans, have a bill that would allow reimbursement for those pharmacists when they're providing that help that they're providing now, but they're not getting reimbursement for it. And it would help by way of prevention in terms of what an older citizen in a rural community gets in terms of their health care. Yeah,
I mean, one of the things that we do a lot of health care subjects, with folks from the Hospital Association
Right.
and PA Medical Society, and we talk about, you know, the impact of the loss of rural physicians. I mean, you talk about pharmacies, we've got that problem where you live in a rural part of the state and you need to see a specialist. It's even now with primary physicians. Right. I mean, the huge problem that creates, the distance they have to travel. People don't realize also not just the large population of seniors, but how big this state
right.
is. I think we take that for granted when, you know, most of us who live in urban or semi-urban area. Go ahead.
Yeah, we have more people living in so-called rural areas in Pennsylvania, several million, by one estimate 3 million,
yeah.
than a lot of kind of rural ag states who have much smaller overall populations. So, you know, another interesting thing about the other end of the age spectrum, I talked about seniors in rural in rural communities on healthcare. Children. There was a report last fall that said that almost 50% of rural children receive either Medicaid for their health care or the Children's Health Insurance Program.
Yeah, CHIP program, yeah.
Wonderful programs, both, but we tend to forget how important they are.
All right, one of the other things that I want to talk about is, you know, we're in an economy, unemployment is down. Actually, it's, I guess, spiked up last month a bit, creating, you know, maybe 270,000 jobs or so, but we still have this problem. A record number of people have dropped out of the workforce. Mm-hmm. Now, you know, hopefully they'll be getting back in, and the attitude of the voters is a little better now. Consumer confidence is up a bit, you know, a little more optimism, right. But there's still far too many people out of work. And you've been working on two things, one in the eastern part of the state, one in the western part of the state, that will help us do job creation. Let's talk about one, and then we'll run to a break, and we'll do the other one. Let's talk about the Philly, and go ahead.
Yeah, in Philly, it's the so-called channel deepening project to deepen the channel, the Delaware River Channel, right. by 5 feet. Just digging down 5 more feet can create thousands of jobs. Some people think in the double-figure thousands. It's been difficult. This has been a project that's been going on for years. We finally are at the point where this year, for example, the project will get $97.5 million, which allows it to move to the next stage. Mm. We're very close to being able to say that this project will be completed in 2017.
So that means that cargo ships that might go somewhere else can now come there, bring in the business, bring in the goods and that, you know, would be used in our state instead of having them going to some other place creating jobs there. Yeah. Is that the whole point?
Exactly. And I think it's a job creator not only for the southeastern corner of our state, but even beyond that because of the economic activity that starts from the Port of Philadelphia and moves across the state. All
right. When we come back, we're going to head back out to Allegheny County and talk about, I know, locks and dams. You wouldn't think about that in a place like Pittsburgh. Well, you do have 2 rivers, and they meet there, forming the Ohio. We'll be back with Senator Casey in a minute.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine, and by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back. Final segment with U.S. Senator Bob Casey. We're talking about job creation, some programs that the senator is working on to bring jobs to PA. At the break, we talked about, you know, that it's actually the Allegheny and the Monongahela meet and form the Ohio. The senator knows that. And in the studio back there, I noticed that some folks were trying to figure out what those 2 rivers were, but we got that straight for you. All right, locks and dams. If you mention that for, you know, Western Pennsylvania, people go, what's that about? But go ahead, it's important.
Yeah, basically a waterway system that's been around for almost as long as our Commonwealth has been in existence. And these waterways in southwestern Pennsylvania allow commodities to move. So these big barges have to be able to move in that waterway system. The locks and the dams, of course, control it, but like a lot of our infrastructure, they've really degraded. Yeah. So this new effort, last year we had to pass two two separate bills to get this done. And again, this was bipartisan because you had guys in places like Kentucky and Tennessee who wanted it done as well.
Oh yeah, because it comes down to Ohio, right?
So it helped a lot to have bipartisan support. But this will allow a system which has been underinvested in to have more investment in the infrastructure. This is a 200,000 job impact in the sense that existing jobs, 200,000, are dependent upon this. And if somehow it grinded to a halt because the infrastructure crumbled, we could have a jobs and an economic crisis in southwestern Pennsylvania.
I mean, one of the things that I don't get, and we do a lot of transportation. You know, we did this business in our state, the $2.4 billion a year. You know, for next several years to do roads, bridges, and mass transit. We've done. Here's what the thing that I don't quite get. Why I think liberals and conservatives ought to agree. We need an infrastructure. We can't get goods and services. It's good for the economy. It's good for business. It's good for labor. What is the debate? And we have to find a way to pay for it, right? Has to be paid for. But in the long run, given we're a transit state, you know, you go from New England, you want to get to the South, you want to get to, am I wrong? You have to, unless I miss my geography, why can't we agree? Now, we can argue about which projects ought to be done. But the fact that we need a modern infrastructure, I don't get the opposition to that. And again, I'm not being partisan about this because we do have Republicans and Democrats, as you point out, who understand that.
Well, it may be, Terry, on transportation, the bill that where we'll run out of time in May, it may be that now that we have a Republican Congress and a Democratic president in his last 2 years, and we have a real need to get a transportation problem solved, maybe that can work and we'll finally get a bipartisan agreement.
Because everybody will get a little something about what they want, maybe for their own states. And
that's the way it should work.
Well, but that's the way that's the way the Republic has always worked. But I think we're at a point where infrastructure every 20 or 30 years just needs to be refurbished. We have to make those investments, whether it's, you know, on Route 80 in our state or the Turnpike or whatever, you know, 7,000 miles of roads deficient. Right. 25% of the bridges structurally deficient. I mean,
it's kind of the leaky roof analogy. You don't wait to fix your roof until the roof caves in. You gotta maintain a house, and you gotta maintain your infrastructure. I think it's creating not just foregoing a job creation avenue, but it also can create an economic crisis if you don't invest in it.
Thanks for coming in. We appreciate it. You're welcome here along with Senator Toomey anytime. We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.